Giving children medicine safely can be a complicated task. Do you know if you're giving the correct dosage? Registered nurse Jean Wiseman from the Capital District Child Care Council is here now. Perfect timing. It's cold and flu season.
It is. And what we'd like you to know from the council is that OCFS, the Office of Children and Family Services, require that child care providers be certified to give medications because it is such an intricate process. I don't know if you're aware, but according to the Center for Disease Control, 1 out of every 151 2-year-olds are in the emergency room with accidental overdose.
Wow.
So pouring is important, and OCFS wants child care providers, as well as parents and anyone caring for children, to be able to accurately measure and pour correctly.
Now, it gets confusing because certain medicines have their own measuring cups. You don't want to mix and match them. I know in my house sometimes they get mixed up, and I want to make sure to keep them separate because a teaspoon is not a teaspoon is not a teaspoon. I mean, you may think it is, but it's not.
Exactly, and as you can see, you don't want to use household items at all. That teaspoon and that tablespoon are very close in size, and you have your plasticware.
All three are different, but they're all considered teaspoons.
Yes.
So, I mean, this is what my mom used to do when it was time for us to get medicine.
Yeah, not the best way to give
not
medication.
Anymore. So, and medicines now, too, have combinations of drugs in them.
They do. You can get the cold remedy stuff, may have an antihistamine as well as something like Tylenol in it. So you want to be sure you're giving it correctly. If you have a very ill child, you may be alternating between Tylenol and Advil. So giving the exact measurement is the way you want to go, and we want to be sure everybody's doing it safely.
So now, when you bring your child to child care and there are other children present, how do you make sure that the right child gets the right medication and the right dose?
There's a class you have to take to train you what to look for. There are requirements under OCFS regulations and under the Medication Administration certification that cause you have to bring an order in from the doctor. You have to check 5 rights. There's a whole curriculum that we go through, and child care providers have to pass the class before they can agree to start giving medication in their programs.
Even the school nurse in our public school is not allowed to give even Tylenol. So if my daughter's in school with an earache, I have to go give it to her myself. So, I mean, that just shows how strict the guidelines are.
It is, and OCFS has designed this class so children are able to get their medication when they need to. And there are children with special health-related conditions that may need medication on a routine basis. So we want to be sure they're giving the medication safely.
Right, and it's really important too.